Right now, India is experiencing the world's worst coronavirus outbreak. Today,
we were the hospital, we are supposed to give life. If we cannot give them oxygen, what is the situation? When patient comes to, the patient will die. Patient will die.
As we know, this pandemic of Covid-19 is very worse since March 2020. Most of the country locked down their country as an effort to stop this virus, but until today, the number of cases recorded are very high every day. As is India, there are 22,296,414 cases recorded, and it's involved 242,398 dead cases. This number will increase every day because of the number of patients who need the assistance machine, such as the oxygen machine, is high, but the number of the machine that the country has to fulfill the demand of the patient are very low. Therefore, by review this news, we can relate it with the concept of supply and demand that we already learned in managerial economics. So, demand is the ability of the customer to consume a product or services with the price that they're willing to pay, while the supply is the amount that offered to the customer by the producer by looking up the price, which will give them profit. Both of these concepts has negatively relationship. When the price is higher, the demand will decrease because the ability for the consumer to consume the product will decrease, while the higher the price, the higher the amount of product or services will be supplied by the producer. In business, the main issue that faced by India is the lack of oxygen supply, which is referred to the oxygen machine. As we know that this machine only supplied by the hospital or medical center in a particular country based on the patient need. But what happened now is the highest number of patients who need the assistance from the machine to continue their life make the demand of the machine increase while the supply is remain the same and facing a shortage. Therefore, a family or a person who willing to pay the higher price to make sure that they will get the machine to be used for their family to continue their life. This will affect the demand and the supply because when the demand is increased and the demand curve will shift to the right while the supply will remain the same. Therefore, the price of the product will increase and the quantity of the product will increase. This is because both of these concepts have negatively relationship or inverse relationship.
Going to talk about the factors. The number one factor is that there is no centralized coordination. According to experts, India produces adequate oxygen at the rate of slightly more than 7,000 tons per day. The majority is intended for commercial use, although it may be redirected for medicinal reasons. The Indian government has now focused the majority of the country's industrially generated oxygen supply into the healthcare sector. Due to strong demand, manufacturers have been increasing production in order to deliver more than 9,000 of tons of medical oxygen by mid-May. So, however, the majority of oxygen producers are located in India's east, while the country's soaring demand has been concentrated in the cities in the country's west and north. The second factor is actually inadequate transport and storage capacity, which means that the nation lacks of sufficient transportation of storage space, which means that cryogenic tankers must deliver liquid oxygen at very low temperatures to manufacturers, who then turns into gas for cylinders. However, India lacks cryogenic tankers. So the lack of oxygen has been a major issue, not only in suburbs but also small towns and villages where the health system is still inadequate.
In India, procuring oxygen is a task that normally doesn't fall to patient's family. But with the country confirming more than 3 lakh coronavirus cases a day, medical supply chains have been broken. There is a high shortage of oxygen. Typically, healthcare facilities consume about 50% of oxygen supply, leaving the rest for industrial use. When India's medical oxygen requirement was 3,842 metric ton, active COVID cases were 12,64,000, but now the cases has become almost double. India's second wave, nearly 90% of the country's oxygen supply, 8,000 metric tons daily, is being diverted for medical use. That is nearly 3 times higher than the consumed every day at the peak of the first wave in September last year. Demand has been growing between 6 to 8% each day, so the demand is high and it is demand shock. Most of the factories that produce oxygen in India are in the eastern part of the country, more than 1,000 miles from the major cities like New Delhi and Mumbai. Delhi and some other states do not have their own oxygen plant and are relying on the import. Several big hospitals in Delhi are relying on the daily oxygen supplies, but they are not getting enough to keep some as backup in case of emergency. So supply is low and the curve going leftwards. Delhi alone reported more than 20,000 new infections and 407 deaths in one day. There are 50 COVID beds and space for 16 ICU patients in one hospital, but has had to refuse admissions as there is no guarantee of oxygen supply. At Delhi Batra Hospital, COVID-19 patients died after an oxygen delivery was delayed by just 90 minutes. Several more such incidents have been reported across the country. Faced with a shortage of oxygen supply to treat an unprecedented rise in critical COVID-19 patients across India, its government last night decided to ban the supply of oxygen for industrial purposes, but the government have been slow in distributing life-saving medical supplies donated from abroad. So the government raised the oxygen supply 730 tons from 490 tons per day in New Delhi as ordered by Supreme Court.
The COVID-19 situation in India is in severe condition, and the medical resources such as oxygen are in serious shortage. The Indian Navy said they had sent 4 warships to other countries to transport oxygen on 30 April. On 2nd May, the Indian Prime Minister Modi chaired a high-level meeting with the top officials to discuss measures to increase oxygen production and supply to alleviate the current medical oxygen shortage in India. According to a statement issued by the Prime Minister's Office of India, the new measures include the establishment of temporary care centers for patients near the oxygen plants, the plan to set up 10,000 beds with the oxygen supply facilities. About 1,500 oxygen plants will be built in the whole country, transfer the existing nitrogen plants into oxygen plants. To cope with the medical oxygen shortage crisis, the Indian government has taken a series of measures before. For example, the establishment of new oxygen plants, the opening of special trains to transport oxygen, the use of military aircraft to transport oxygen equipment, and the import of medical oxygen.
India is prepared to deal with the increasing number of COVID-19 cases, coping up with the current situation such as adverse effect on the economy and human living, period, along with the various approaches undertaken to overcome this pandemic. A few segments will emphasize here. First is economy, and the second is the human life. This is the evidence that negative impact due to the coronavirus is effect on the human living. People are dying as the oxygen shortage. However, it's a big question for the India now, how the government will overcome this worst issue now. As the COVID-19 Indian economy is the halt, and the oxygen which the main issue are insufficient for the population of infected COVID-19 patients. Thank you.